I want to speak to you today, just for a few minutes, about the airline industry. And I want you to imagine not the industry that I use to fly here, but imagine an industry where we don't really talk about airlines, we talk about passenger care. And instead of 4 or 5 major airlines, there's about 5,000 of them, 20 or 30 in every city. And they don't really hire pilots. Instead, they have affiliations with individual businesses that have a pilot and a receptionist and a file clerk. And when you get on board that airplane, you don't actually pay for a ticket. You get a $5 copay to get on the plane. And the airline has to collect the rest of it from an aggregator who instead charges you or your employer $200 a month so that you can fly. And in exchange, they try to regulate how much you can fly because they've noticed that the biggest cause of airline safety problems is the fact that people actually fly. And that they could significantly reduce the cost of travel if fewer people flew. Now the pilots, if they need access to charts or maps, need to send someone to the back of the plane where they're all kept. And if they need to talk to the FAA or they need to talk to another airplane, they need to use a telephone or a fax machine because they don't really have the ability to communicate any other way. And to fix all of this mess, the federal government finally stepped in and said the answer to this is a national program to limit your access to airlines and to make sure that the airlines get paid less for creating such a mess. Think that would work? Well, that's healthcare, and that's our business. We're the largest economic sector in the largest economy on the planet. Today, about $2.5 trillion goes into healthcare. That's escalating rapidly. Within the next 5 years or 6 years, that will almost double to $4.5 trillion. Today, it's about 17% of our total economy. By 2018, probably 19%. And if it continues on the trajectory it's on, within the next 30 years, it will become a quarter of our economy. Now, you've all heard about the healthcare reforms, the ARA, the HITECH Act, a number of government interventions that are attempting to fix a fundamentally broken system. A system that calls itself healthcare, but in fact, the entire model is built around treating people who are sick. It is not about keeping people healthy. No one in the United States healthcare system gets paid to keep you healthy. They get paid to treat you when you're ill. These reforms will not reduce the cost of healthcare. Instead, they will slow the growth of the cost of healthcare. All of the savings dollars that you've heard about really are savings off of projected growth. They are not savings based on current spend. Now this, to me, looks like an opportunity. When you have $4.5 trillion flowing through the American economy, and when so much of that is based on the inability to transact a fundamentally information-based business efficiently and effectively, this looks like an opportunity. But make no mistake about how badly this is broken. If you look at the evolution, the continual flow of new information, new research, new knowledge, that defines the best practices in healthcare, that defines the best pathways, the best outcomes based on objective evidence, that information doubles every 2.5 years. It's almost impossible for a physician to keep up with his or her research, even in their own narrow area, much less for an industry to keep up with the flow of new evidence-based medicine. The business challenges are extraordinary. Healthcare operates typically on a 1% to 2% margin, highly capitally constrained, difficult to attain the dollars and the resources, and with shortages of skilled nurses and physicians to be able to deliver the care that they're chartered to give. And at the heart of healthcare is information. Your medical record, the medications that you're on, the procedures that you've had in the past, your current healthcare condition, these are all pieces of information that a caregiver needs to treat you effectively. This is one of the few industries where that information literally means life or death. If you walk out of here today and get hit by the Coors beer truck and sent to the emergency room, chances are about 95% that the physician who treats you in that emergency room will have no knowledge of your medical history. No idea of the medications you're on, no idea of your prior conditions, no idea of possibly even your next of kin, living wills, or anything else that might reflect valuable information as to how you might be treated. And that physician is literally operating blind, working only on your current presentation. If that information were available, if the same information that you use to reserve a table at a restaurant tonight, that you use to make a reservation on an airline tomorrow, if that fundamental bit of information that represented your healthcare state were available to all providers, we believe that we could save tens of thousands of lives every year and cut hundreds of millions of dollars out of the treatment costs and literally billions of dollars out of the administrative costs of healthcare. Now that rests on technology. The savings are phenomenal in this $3 trillion by implementing technologies that allow this kind of information to flow, making that information available to insurers like Medicare and Medicaid and other private payers, implementing the ability to exchange electronic healthcare records easily between providers and even with you, the patient or the consumer, and implementing tools that allow physicians to gain access to current evidence-based medicine, to proven disease treatment pathways, to look at drug-drug interactions and other of tens of thousands of rules that no human mind can process. The savings mount up into the hundreds of billions of dollars, not to mention the thousands of lives saved. We're right in the middle of this, my company, McKesson. We are the largest company in that largest economic sector of the U.S. economy, and we touch virtually every player in healthcare today. We distribute about a third of the medications that you might pick up at your local drugstore. If you call 1-800-ASK-A-NURSE, chances are 1 in 2 that you're talking to McKesson. If you go to a hospital, chances are 1 in 2 that they are using some of our technologies. If you're receiving a claim from your payer, chances are about 1 in 3 that that claim was processed by McKesson. And if you have a prescription written, chances are 4 in 5 that we handled the electronic transaction for that prescription. So we know healthcare, we know every player. We have deep connections with every one of those constituents. And the demand we see coming from all of them is not give me better feature functionality in the systems or the technology or the supply chain that you represent. But the demand that we see coming from all of them is connect me with the other stakeholders. Connect me electronically between the physician and the pharmacist and the patient, the manufacturer and the person receiving the drugs to get an allowed discount. Virtually any pair that you can create in this stakeholder network, the demand is for exchange of information in an industry that is the least served and the least sophisticated of all information exchange industries on the planet. Our footprint at McKesson in Georgia has a long history and is substantial. Most of the development organizations that produce McKesson's clinical software, administrative software, revenue cycle software, and transactional software are located here in the Atlanta area. We also have one of our 2 strategic data centers housing many, many thousands of servers and handling 80% of the traffic for prescriptions and claims in the United States. We have major distribution centers in Georgia that handle the supply chain that feeds all of healthcare. And working together, these organizations are beginning to tease apart and beginning to solve the fundamental technology issues that face healthcare. We think these emerging challenges are no different than the challenges that other information-based industries are facing today. The only difference is healthcare is a little slower and a little less willing or more cautious about adopting these technologies. We're moving from a world where individual technologies that are installed in hospitals and physician offices will move back to the cloud. We're living in a world where those technologies will become more mobile, and we're living in a world where these production of electronic healthcare records for every American in America will significantly improve the quality of healthcare, but also represent a substantial security and privacy risk, much like the credit card industry. When we now have 100 million patient records, how do we safeguard those records and keep the access to those records private? Just as the growth of smartphones has led the disruptive development of applications in every other information-based industry, now with some 350 million people experiencing the internet in a fully mobile environment. Healthcare being fundamentally mobile, where physicians travel to see you in your exam room or nurses go to see you in your patient room. This mobile technology and the improvement in the bandwidth behind it will disrupt the healthcare industry. But for that to happen, we need to move the data outside of the 4 walls of a hospital or of a physician's office, and we need to move that data back into an aggregated form accessible over open public networks. This means retooling our applications to be software as a subscription-based models, multi-tenant models that are housed not by each hospital and each physician office in the country, but are housed in remotely hosted cloud-based environments that can be accessed over a network by any physician or any caregiver anywhere. Now, doing that creates enormous stores of data. Today, we have petabytes of information comprising the records of hundreds of millions of Americans. Every federal government employee, their personal health record is stored by McKesson. We handle over 30 billion transactions a year in the healthcare field, representing an enormous exposure in terms of privacy and liability, but an enormous asset if it can be properly mined and if the proper analytics can be placed on top of it to serve healthcare even better. Imagine having access to that data to find appropriate people to participate in clinical trials, to deliver your personal health care to you in your personal record, to allow physicians with your authorization to gain access to your records anywhere you might present yourself for treatment. handling that large amount of data, distributing that data in an appropriately accessed fashion to smart devices is the next wave of healthcare technology. And I'm proud to say that McKesson is helping to lead that. Behind all of this, of course, is the problem of security and access. Many of you are probably aware of the amount of money the federal government is pouring into creating electronic medical records, but you may not be aware that most or some of that is being paid for by their anticipated penalties of hospitals and physicians who breach that information, with mandatory penalties for every breach of a patient record. If you breach a patient record, you get put on a public website. As of 2 weeks ago, 6 million patient records had been breached in the last year and a half, resulting in fines of well over $10 million, helping to pay for the healthcare reforms. We would like to not be in that position. So to do this, we need to build capabilities we don't have. Just as every industry is retooling for mobility and cloud-based computing and retooling for the analytic capabilities and large data handling capabilities and privacy and security issues surrounding that data, we're retooling too. And that represents an opportunity for you as a technology community to help join us to solve these problems. We've reinvigorated our approach to technology. In the last 3 or 4 years, recognizing the turn we need to take, we've implemented a significant number of programs to create a highly valued technology community within McKesson. Reward programs, recognition programs, recruiting programs, and an entire office that's devoted to doing nothing except bringing our technology community together to plan at an enterprise level and an industry level instead of at a product level. The community, the McKesson technology community, has responded to this very powerfully. And what's fascinating is they're seeing solutions faster than our business leaders are, and they're beginning to pull their business unit presidents and their business unit planners toward common solutions and toward engaging in more effective and modern and contemporary approaches to technology than we've ever had before. So I hope that you'll help us by considering becoming a part of our community as well, either as a supplier, as an employee, or as a partner for those of you who are in the healthcare industry. And should you choose to do so, I look forward to you sending your email to Robert to let him know of your interest. Thank you very much.